Preview.
Medical Emergencies in Remote Environments by Brian Harper. Given our aging population of divers, together with medical advances, many people who previously might have been unable to participate in diving or travel are able to reach remote destinations and participate in this wonderful sport. When we head out to hike, dive, fish or explore, we bring our personal medical histories with us. Dive operators are aware of this, and they therefore also require the completion of medical forms, in which divers should list known illnesses, conditions, allergies, and medications. Many conduct this practice primarily to ensure that they are protected in case of legal issues, but they also recognize the value of having this information in advance, particularly if an emergency occurs subsequently. This information is important enough that recreational divers and outdoor enthusiasts should consider sharing it with each other, even when adventuring outside of the context of a professional dive or travel operation. Perhaps more importantly, they should be prepared to provide basic assessments and treatments should a medical emergency occur in the backcountry, in or out of the water. In this podcast, we will discuss 4 categories of emergencies: respiratory, abdominal, neurological, and cardiovascular. Respiratory emergencies warrant quick action. People who are unable to breathe may die within minutes unless there is an appropriate intervention. The reason why people might find it difficult or impossible to breathe include anaphylaxis or severe allergies, asthma, foreign bodies, and lung injuries. Severe lung injuries typically are not manageable in a field setting. When it's suspected, administer oxygen and seek medical care as quickly as possible. Suspect a potential lung injury if respiratory distress occurs after diving. Rescuers should refer to their CPR training to provide appropriate treatment for foreign body obstructions. People who experience breathing difficulties may sometimes assume the so-called tripod position, which is getting down on their hands and knees. Gasps or wheezes may become audible. If asthma is the cause of the breathing difficulty, breathing bronchodilating or air pipe widening medication may be needed. People who have asthma should have their necessary medication with them and make sure that others are aware of it. An asthma attack may be provoked by exercise, dry air, cold, smoke, or various other factors. Anaphylaxis often follows exposure to an allergen, which may include substances that are consumed, inhaled, injected, or simply touched. Whenever possible, remove the allergen from the person and remove the individual from the offending environment. If the person has a known allergy and develops breathing difficulties, suspect exposure to the allergen. Always consider administering oxygen and administer epinephrine or adrenaline if the symptoms include difficulty swallowing, breathing, or large areas of swelling. In addition, a person who suffers from respiratory distress due to anaphylaxis may require the use of an antihistamine, such as diphenhydramine or Benadryl. For any individuals not breathing adequately on their own, oxygen is recommended, and people not breathing at all should be given rescue breaths, either by mouth, bag valve mask, manually triggered ventilator under the hands of emergency medical personnel. Prompt evacuation for medical exam is recommended with any respiratory distress, even if it subsequently resolves. Abdominal emergencies are quite common amongst travelers. Even in locations where water is safe to drink, changes in activity, schedule or diet may cause discomfort or diarrhea. The important thing is to be able to determine whether the abdominal distress warrants medical evaluation or whether it's just some transient phenomenon or indigestion. When abdominal pain is accompanied by fever or lasts more than 12 hours, evaluation should be prompted. If pain becomes very localized and is associated with signs like dizziness, rapid breathing, lightheadedness, sweating or anxiety, these signs may indicate shock. Blood in the urine, stool or vomit, unusual hardness or softness of the abdomen, or resistance to touch are grounds for seeking medical care. Women of childbearing age may have an undiagnosed pregnancy and complication. Finally, anyone who is nauseated and vomiting or has diarrhea for more than 24 hours should consult a medical practitioner. Such individuals are likely to become too dehydrated for this to be managed effectively in the field. In the absence of any of these red flags, it's appropriate to monitor a person and encourage them to eat a bland diet consisting of foods such as bananas, rice, applesauce, and toast until the symptoms resolve. Antidiarrheal medications such as Imodium may be helpful for short-term management of diarrhea, but never for extended periods of time or if there is blood in the stool. For people who struggle with constipation, caffeine or alternating hot and cold liquids such as ice water in the one hand and a cup of coffee in the other may be helpful. Many factors can cause neurological impairment, including temperature extremes or intoxication. Decompression illness or head injuries are always a possibility, and in the absence of any causative factors such as those, underlying medical issues might be to blame. A stroke or cerebrovascular accident is an interruption of blood flow to the brain, either as a result of a clot or bleeding. Facial droop, weakness, or paralysis on one side of the body, impaired speech, memory, and cognition may all become apparent. There isn't much that can be done specifically for a stroke patient in a remote setting, but providing oxygen, rapid evaluation and evacuation, and lying the individual on the affected side to protect their airway are all recommended. Continue interacting with the individual as before the stroke, even if they can't participate in the conversation or seem unable to understand you. A seizure is the result of disorganized electrical activity in the brain and may manifest as a period of unresponsiveness or dramatic uncontrolled physical activity and jerking. The best thing for a rescuer to do is to allow for the person experiencing the seizure to be protected from is to make sure that the person who has the seizure does not injure themselves on anything in their immediate environment. It is best to remove things. Do not attempt to restrain the individual or put anything in their mouth, but it's appropriate to cushion, protect, or remove any hard objects that may cause additional injury. If a seizure occurs where other individuals are able to witness it, realize that the person's dignity should also be protected and provide appropriate crowd control if this applies. Obtaining medical information is not necessarily possible if a person suffers a neurological emergency or unconsciousness spell, but clues might be found in their surroundings or pockets. Odors, medical alert tags, bracelets, emergency necklaces, or the medical history known to other individuals may be of assistance. Because a serious injury such as a head or spinal injury may be possible, do not move an unconscious individual unless their airway is compromised or the environment is unsafe and it would be more dangerous to leave them where they are. Arrange an evacuation for anyone who is unconscious or shows symptoms that may indicate a stroke or a seizure. Cardiovascular emergencies. Chest pain in an environment where emergency medical services are not readily available is cause for decisive action. This is particularly important if individuals have sweating, cool or pale skin, shortness of breath, dizziness or anxiety, chest pain due to angina or a myocardial infarction. Angina is pain due to inadequate blood flow to the heart that can be relieved by rest or medication. On the other hand, myocardial infarction is actually death of heart tissue resulting from a persistent interruption in blood supply. Overexertion and stress commonly precede such chest pain, which may be described as crushing or squeezing pain. Sometimes the chest pain is accompanied by pain that radiates to the jaw, left arm, abdomen, or may even be referred to other parts of the body, such as the back. When in doubt, any unexplained upper body pain should be considered to be of cardiac origin. The first step in addressing chest pain is to encourage the patient to rest. Help him or her to relax in the shade, take deep breaths, and loosen the collar or any constricting clothing. The individual should assume whatever position is most comfortable. Administration of a baby aspirin, 80 milligrams, is a good idea as long as the patient is not allergic to it. Oxygen is called for, as is any medication that the individual takes for a known heart condition, such as TNT or nitroglycerin. The medication should be taken according to physician's instructions. Even if chest pain passes, prompt medical attention is recommended. Part of the challenge of dealing with these medical problems is that rescuers have limited resources. Don't underestimate the importance of good judgment, a conservative approach, emotional support, a well-crafted emergency action plan, and the ability to arrange and execute speedy evacuation.